Every day, transgender and gender nonconforming people bear the brunt of social and economic marginalization due to their gender identity. Access to health care is a fundamental right that is regularly denied to transgender and gender nonconforming people. In 2008, the National Center for Transgender Equality and the National Gay and Lesbian Task Force formed a groundbreaking research partnership to address this problem, launching the first comprehensive national transgender discrimination study. Over 7,000 people responded to the 70-question survey. They frequently experience discrimination when accessing healthcare, such as disrespect, harassment, violence, and outright denial of service. Study participants reported barriers to care, whether they were seeking preventative medicine, routine and emergency care, or transgender-related services. The discrimination they received deterred them from seeking and receiving quality health care. Key healthcare findings showed that study participants reported very high levels of postponing medical care when sick or injured due to discrimination or inability to afford it. Transgenders face significant hurdles to accessing healthcare, including refusal of care, harassment and violence, and lack of provider knowledge. 60% of respondents seek care through a doctor's office when sick or needing health advice. 28% use health centers and clinics, and 4% use primarily emergency rooms for health care. Studies show that individuals who use emergency rooms primary care experience more adverse health outcomes than those who seek a primary physician. Discrimination by medical providers and denial of care are commonplace in the lives of transgenders. 24% of study participants reported denial of care in doctors' offices and hospitals, 11% in mental health clinics, 5% by EMTs, and 3% in drug treatment programs. 28% of study respondents reported verbal harassment in a doctor's office, emergency room, or other medical setting, and 2% reported being physically attacked. Due to discrimination and disrespect, 28% of respondents postponed or avoided medical treatment when they were sick or injured, and 33% delayed or did not try to get preventative health care. Being a transgender requires a lot of medical treatment, from counseling and hormone therapy to surgery, and being verbally or physically harassed while trying to seek the medical attention is a problem. The data gathered speaks a tremendous need to examine the connection between multiple incidences of discrimination, harassment, and abuse faced by our respondents in the healthcare system and the high risk for poor health outcomes. Discrimination in the healthcare system presents major barriers to care for transgender people. The results of this study recommend that the medical establishment must fully integrate transgender-sensitive care into its professional standards, that public and private insurance systems must cover transgender-related care, the amount of transgender-sensitive health education, health care, and recovery programs should be increased. Another place that transgenders battle discrimination is in the workplace. Steve Stanson was the city manager of Largo, Florida for 14 years. The city commission started the three-step process to remove Stanton from his position less than a week after he announced he was a transsexual and was planning to seek sexual reassignment surgery. Although the citizens of Largo protested, Stanton was still removed from his position. Since then, the transgender population has stepped up. About 1/3 of the U.S. population is covered by transgender-inclusive anti-discrimination laws, varying from statewide to city ordinances. Currently, 9 states provide transgender citizens protections in the workplace, but the federal government has failed to extend special coverage to transgender employees. Title VII of the Civil Rights Act of 1964 makes it unlawful to fail or refuse to hire or to discharge any individual or otherwise discriminate against any individual with respect to his compensation, terms, conditions, or privileges of employment because of such individual's race, color, religion, sex, or national origin. Throughout the past few decades, lawsuits have been incorrectly won or lost because of the unclarity of the definition of sex. Transgender people deserve protection against discrimination, as other cases has deserved protection because of a continued environment of hostility in the workplace. By including transgender within the definition of sex, the entire transgender community would be protected. There would be consistency between federal and state legislation, and the courts would be equipped with an existing framework to enforce prohibitions against discrimination. Lastly, it would provide an expedient answer to the transgender community, an answer that the community has been waiting long to hear. Relatively little attention has been given to the problem of suicidal behavior in lesbian, gay, bisexual, and transgender populations, despite reports of elevated risk for over 4 decades. Gay and bisexual youth have been defined as a risk population, but little information has been provided about contributing factors and did not address whether targeted interventions, prevention strategies, or public health policies are needed to reduce suicidal risk in this population. Sexual orientation is generally defined as having at least 3 dimensions: sexual self-identification, sexual behavior, and sexual attraction or fantasy. Gender identity refers to a person's internal sense of being masculine, feminine, or androgynous. There is limited understanding of which dimensions of sexual orientation are most meaningful related to suicidal behavior. Because death records do not routinely include the deceased person's sexual orientation, there is no official or generally reliable way to determine rates of completed suicide in lesbian, gay, and bisexual people. Although the LGBT community utilize mental health services more than heterosexual individuals, it is not clear to be most effective in reducing depression and suicidal behavior. To advance the knowledge and understanding of lesbian, gay, bisexual, and transgender suicide and suicide risk, public and private funding for research on the LGBT suicide and suicide risk should be expanded. We should identify and test new ways of determining sexual orientation and gender identity among people who die by suicide, continue to test which aspects of sexual orientation and gender identity are most strongly related to negative mental health outcomes, including suicide attempts, and conduct studies of suicidal behavior and suicidal risk in diverse groups of transgender people across the lifespan. To improve LGBT suicide prevention efforts, the LGBT suicide risk and possible interventions for reducing risk in national and state suicide prevention strategies and plans should be addressed. Educational and resource materials should be provided to LGBT organizations, and training in LGBT suicide risk for staff and volunteers of suicide crisis lines, law enforcement, emergency care professionals, and others who work with suicidal individuals should be encouraged.